first annual Ghana Prisons Mental Health Care Symposium akoso ewo Ghana Prisons Headquarters and our cantonment in Mountain so na dwumedi a wo mudi yabotae ne a wo mugina eti a wo mato ne din say substance use, the criminal justice system, the role of prisons in rehabilitation. Na te se nkofo asebe wo mo efa enubone na afi yahwe atenefie so se na wo mo nso edi wo mo asem edi aten ebu aten afi yedo ko biekun ewo prisons ne so ekwan hodo metimi afa na wo ma dane ni pa brabo se na be a abrabo a ede omo ba honom no wo meba monten so no na wo meja to honom afa brabo papa na enkomotwetwe ne de bebre pa na course wo honom a wo mo ehweye na afi wo mo bo dero ene enkofo awa de biefie etwem komo kyerechero makwan hodo bi a ekokoba ne se wo enya ho se wo fa enubone bi na koba ne se uhu akwa dimu pa de boni ka se fe na addiction na akwa hodo bi a mbetima ko na wetima age uhu afiri mu wo mu kire mu se nya fe de kura se oni obi bedi hu komo a kire ne se embe ade yi ana wakwa dimu nti behia moa na se moa bi wo hono ma wo metimi e de aboa wa fe so wo mo kire afoforo bi a wo mo fa enubone ne se ohunu se wo bi awie mu pa na se wenya addiction yi bia enya afi na da ne de obehunu bia na se wubu na ten yi na ten hwena be ho na woni ni nya kasa kire wo mo kire mu se yenhunu se yade bi na adokoro mo chen se yebebu o mo ten na ko ba ne se da ne de nia no wo ma akotete na afi wo mo dwumedie no wo mo etimedi na penifo ahodo bi a wo mo kopie mu honom no ekoko gina Bestel Foundation anemu free say wo mo partners anase wo mo ka ho na sa dwumedie no etimi ekoso wo mo nso omudwumedie omudie ni nia ne se wo meboa abode ru afa adwene mu yade ho na adehye bebre na timi ate ekwa ahodo ebetimi afa na ya twe mu efiri mu nia no so no wo mo boa ekyerechire eni ntino kofa by Edema Bestel Foundation Ra Peter Hasler emra wode ne nsam twodwa no ochire mu se wone de anaso wone ne dwumekuo ne de wo mo da esu ni ane se wo mo de abenfo be free United Kingdom aba o man ga ne mu no ma bebo amancheche ne tima akoso na afega na ne hye ne enyom ho ntiase se ye ka addiction a ye hunu se ya de egen se sa ni pa kra no ye beto no pehwi na eja no se wono a enkonkobo ne bra.
Well, every country is different, and I would never say that a way of doing things in the United Kingdom is definitely right. You need to experiment and find what's right for your country. But the research is very important, and learning from other places, not just the United Kingdom, but Europe and America, see what other places are doing. And take the best pieces of that, bring it all together. Because I visited the prisons here, and there's lots of things I actually really admire about the direction that the prisons are going in. And this is going to sound very strange, but there's aspects of if I was a prisoner, there's aspects of being in a prison in Ghana that I would prefer than being in a prison in the United Kingdom. The main aspect is that certainly at Nsawam, where I've spent most time, during the day, most of the prisoners are enclosed, obviously in the prison, but they're actually free to interact and move around, help on the farm, do cleaning. They're gainfully employed during the day. In lots of UK prisons, prisoners are confined to their room for huge amounts of time, sometimes as many as 23 hours out of 24 in a locked room. And that is not good for your mental health, to be confined for that length of period. So I was I'm pleasantly surprised when I saw how Nsawam had managed to make sure that the day was active.
And no Mama Stella Ajimane so a quantia for CEO at the Ma Bestel Foundation, one also actually must say, Womushini Masanka, Wombe, exchange programs na say Ghana de sheni bi ba kopie mu UK na UK for no so aba na wo ma ba be kire kwan hodo bi a obi efri abonten eba prisoner ye ne be fa so ne nkoba ne se ni eba betan na afi wa ba be hardened criminal kra wo ba monten so afi kra na wo ba be tete nkrofo pa wo kire mu se saadi ni anu wo mu hwe ni mu se ereduafo titiri pa no wo mu benya nsa no nyuma na afi wo manya nuhu se ne be o meba monten so no wo ma ye ni papa.
The Star Foundation is a registered mental health charity in both UK and in Ghana. For the past 5 years, we've been coming to Ghana and supporting the Ghana prisons and other mental health establishments. And we work very closely with the prisons because the prison is on heart. Our expert, Peter Hessler, who is our patron, has got special interest in the prisons. So the first time we came to Ghana to start the project, he went to prison and he wanted to know and work with the criminal justice system. So we spoke to the champion and we decided that we need to have the first conference to get all the prisons officers in Ghana together. And the next stage is to do it for West Africa. So it's something that we started and we know it's going to go a long way. It's very important to share our idea, share the system in this country and share the system in Ghana. And we learn from the Ghanaian and Ghanaians can learn from the UK as well. And then the ultimate goal is to try and do some exchange programs where our officers here can go to UK, vice versa, because we need to have that experiences. And also one of the things that we really want to do is to have the inmates to be also trained as champions.
Wasansemu ano owura Zebulon so a wa ex-convict na yesenka ne no na wo prison hobi afen so eba no enubone ho dwa ene se wo no ankasa yusu de a wo kire mu se wo yusu bi papa fisha bebre ene yi na Yankopon di ne ho afofi a wade ne ho na wo kire mu se sa enubone no se wo bi be kompa na ya friend addict no eya na efri ahyase ne ekwan hodo ebusua na adofo ede ne fa so fi se wo bi ko sa ate bi anim na se wo bi ayi na ma ene ehunu se wo fa enubone ana se wo ta hye bebre ebusua ni a se wo kra no wo ne da ate wo ni future wo mebo bra bi ani ntino wo ka asem kra nyansa wo mu kra obi anfa anya hwe ekoba ne sa pe na wakwa fa enubone ne se wo kra no agye nkwa wo be fa ne se wo busua no adamfo bibi ebetu bi anu enubone no na wo twa weni akwa hwe no ene ntino ro Zebulon so wa kire mu se wo be sere se wo obi a wo ya ko enubone mu a eyodo na obeda edi ede a kire no.
Stigma aspect is one of the reasons or one of the things that push us away or more into the ground. So the stigma must go. We need people to embrace us, especially when not only from the prisons, but even from the rehab. When you come back from the rehab, it is believed that you have gone through the process and you are okay. So the family need to accept you. And one thing I also want to put it across is that addiction is a family disease. So don't say it is the person who has gone for his problem, so he should take care of that. Any relative needs to be involved because anybody's contribution is significant to the process of recovery. So it is very necessary. What I would say is that, our recovery is first. So definitely you cannot regulate or control how people relate to you. So don't let the stigma take you back. Just stick to your recovery and be honest to yourself. It is not easy, but it is possible.
Ewusia ebejina sanse mu so na yetwa ho kasebo no so ekwa kodi aboafo